right. This is our second meeting of the System of Care Expansion Leadership Learning Community. And the topic today, as you know, is going to be on the National Evaluation and TRAC. And many of you had a lot of questions around both of these components of your work. And so we'd like to use this learning community to give you an overview of both of those systems and then a chance for discussion and question and answers. As I said, this is the second meeting of the learning community. We are holding this learning community monthly, and it's really designed to support leaders in system of care expansion grant states and communities and tribes, such as PIs, PDs, but also other leaders that you identify, whether it's in specific content areas, like in this one, hopefully you've included some of your evaluators, family members, youth representatives, and social marketers and others that may be fulfilling content roles in your expansion work. We would like to use these learning community meetings to talk about topic areas that you identify as important that you'd like some more information on, but not as a webinar where we just present information to you, but to provide an opportunity that you can ask questions, that there can be a dialogue, that we can be interactive, and that you can share information among your peers, as well as get information from some of the resources that we're bringing together on these calls for you. So again, as I said, this particular meeting is focusing on the evaluation requirements. We will start with an overview of the national evaluation and then open it up to questions and answers on that. Our presenter there will be Abram Rosenblatt from Westat, and some of his colleagues will also be available. We will then move to a discussion around the Transformation Accountability System, better known as TRAC. And we also have two individuals from Westat, Jessica Taylor and Michelle Kiser, to present some information and then take questions. And we also have Eric Lulow and Chris Painter from the Child, Adolescent, and Family Branch at SAMHSA, both of whom have information for you on the evaluation and on TRAC, and will be available to jump in and answer questions that they have the information on. So I will turn it over to Abram Rosenblatt, who will start the conversation, giving you, again, a very brief overview of the national evaluation, and then you'll have an opportunity for discussion and questions. So Abram?
Thank you, Beth. Hi, everyone. My name is Abram Rosenblatt, and I am the project director for the Child Mental Health Initiative National Evaluation. And I'm here representing our national evaluation team. And we are really looking forward to working with all of you on your cooperative agreements. And I want to begin by saying congratulations, everyone, for receiving these. If I haven't done a webinar with you before and passed on our congratulations. Just briefly, so you all might be aware, I've been involved in systems of care for a fairly long time and have worked as a local evaluator with many local system of care sites in California. So I'm fairly aware of how this tends to go on the ground at the local site level. So we're going to try and hopefully be helpful to all of you in getting your questions answered, or at least starting to get them answered today, by giving you just an overview of the Child Mental Health Initiative National Evaluation. I want to just start by saying a couple of things about funding cycles. This presentation is somewhat geared toward those sites recently funded in 2015, but we are going to say some things about the 2013 and 2014 sites. So it will be relevant for all of you who are on the line. We began our work at Westat with the 2013 and 2014 funded sites, and so that's where we'll be able to talk about. Those are the sites we can talk about. So if we could have the next slide, please, that would be great. Okay. So before we get into the details of the evaluation, I just want to let you know who we are. Again, I'm Abram Rosenblatt. We have Chandria Jones, who's our project manager. Chandria is in the room here with us. Anna Maria Brannon from Indiana University is a senior advisor. Beth Struhl, who you already met and I'm sure know, is also one of our senior advisors. And Garrett Moran serves as our corporate officer here at Westat. Next, please. So we have a number of partners in the National Evaluation. We are working with the Federation of Families, Youth Move, DMA Health Strategies, Walter R. McDonald Associates, and the University of Washington. So this is very much a team effort. We're lucky to have an expert advisory panel, Johanna Bergen from Youth Move and Eric Bruns from the University of Washington, Allison Cuellar, Alan Daniels, Craig Ann Hefflinger, Craig Love, who is going to be helping us in our work with tribal sites here at Westat, and Deb Rogg. Really importantly, we have a tribal work group associated with the 2015 evaluation. Our goal is to try to understand how to do better evaluation work that is really consistent with the needs of tribes and also reflects how tribes are actually implementing their systems. We have a work group who we're very fortunate to have working with us on this. They include a broad range of folks from different tribes so we can get a broad representation. And as I mentioned, Craig Love here from Westat will be serving as the chair of our group here. So with there are 24 funded sites in the 2015 expansion and sustainability grantees. They go from sea to shining sea, including out there in the Northern Mariana Islands. And so that's our sites for 2015. You can see that the 2013-2014 sites there are 4-year implementation grants, 37 of those, and 1-year planning grants, 20 of those. So we're working with a fair number of sites around the country between these 2 different contracts. So what's our goals for the evaluation? Well, we really are trying to keep ourselves focused on the goals for your sites, and so we're really wanting to assess whether system of care services and supports were expanded, how expansion was implemented compared to expansion as planned. We know that plans sometimes change. And explain how expansion changed in response to external barriers and facilitators that may exist around your sites or that you're working within. The purpose of the evaluation, again, to continue a bit more, is to assess the impact of services on health, behavioral health outcomes, attainment, living environment, social connections, quality of life. Assess whether expansion impacts vary by type of award. There are 2 awards, types of awards in the 2015 funded sites, either made to states or localities. And then to describe the factors associated with the successful expansion, you can see with our multicolored figures here that we are wanting to do this work together. This is a full collaborative effort, both from all of us and our partners at the National Evaluation and all of you who are implementing your systems and your local evaluators who are working with us. So all our figures here are celebrating when we've been able to successfully do this. There are some changes for those of you who are 2013-2014 sites that you might be interested in. For the 2015 sites, we have a focus on state and local levels specifically for the 2015 sites. We do have a different evaluation framework. It's really based on expansion strategies because of the nature of the RFA. We are looking at revising existing measures at state and local levels to match the new evaluation framework. So for those of you who were funded prior to 2015, there will be some measures that will be similar or the same, but not all the measures will be the same across all the cohorts. We have not a nodular approach, which would be something that seems sort of vaguely medical, but a modular approach to measures and instrumentation, sorry for that typo, where we're going to do instruments and measures based on what sites are actually doing. So if sites are not implementing some component of what we are evaluating, we won't measure it. And then we are trying to develop a model for evaluation for tribal grantees. Here's our framework for the national evaluation. You can see on the left side of your screen that we have supports for system of care expansion efforts. We do understand that these efforts exist across multiple levels, and they include the state and local system levels where your grants exist, and also the service delivery and practice levels. We have a strategic framework, and I'm going to ask you to try to keep these in mind as we go along because we'll be coming back to them when we talk about instrumentation. We have 5 key elements: policies and partnerships, services and supports, financing, training, workforce, strategic communications. These elements have been associated with a successful expansion, and so we're using those as our areas that we want to measure. And then we have a range of outcomes, including expansion, improvements in services and supports to improve child and family outcomes. This model drives our selection of instruments and drives our data collection process as we go along, and we do have system of care principles underlining everything we do. So here's our instrumentation and measures. And we know there's a long list of these, but I do want to just start by saying that a couple of things. One is not all of these measures, in fact, most of them are going to be collected by Westat, and so your sites will be in a role of being a participant and collaborator, but will not have to collect data. And you see that under primarily Westat for each of the instruments where that's the case. The other thing I want to say is that we are making a very concerted effort to do everything we can to keep our instrumentation package as efficient as possible so that our burden is as low as possible. We're working with our partners at SAMHSA on this as we go along, and we will try to keep the burden on all of you as minimal as possible, but still to capture the things we need to understand about your systems. So you can see here some of our instrumentation. Just to note a couple of things, we are going to be beginning with 2015 sites. We will be conducting introductory conversations and document reviews. This is just an informal activity designed to learn a bit more about your sites and to set the stage for data collection. It's not a data collection activity. And then we have a number of interviews where we'll be asking different stakeholders and different participants in your systems questions about how things are going. We have some financial mapping and benchmarking activities. We have qualitative and quantitative interviews. We will be conducting all of those. Next, please. And you can see here a few more. A couple of things to note. One is that you can see in most cases we are doing data collection in years 2 and 4 to try to get an idea about whether there's been change over the course of your implementation process. And then I want to also draw your attention to the Child and Family Outcome Study. This is an activity that has a grantee. You will have considerable responsibility for data collection. So I'm sure we'll have a lot of questions about that. One other thing I want to say, especially for 2015 sites, but also for the other sites, we will not engage in any data collection activity until we've told you about it in advance. You'll have plenty of time to get ready. We will provide assistance and help and webinars before we start every data collection activity. So it's our very strong goal not to surprise anyone with anything. So this is the first time for some of you, you're seeing this. We understand that we'll need to have follow-ups. This is for the 2015 grantees or timeline. We are in the process of getting our OMB package and instrumentation together. And as we do that, we're going to be working with your sites to build some infrastructure for data collection, both locally and to help your sites get ready for data collection as needed. We hope to complete the OMB clearance process by September of 2016 and start data collection then. Of course, we'll see how that goes with OMB, but that's our goal at this point. So for training and support to grantees, this is important. We have training and technical assistance on data collection, reporting, and evaluation processes. We have an email help desk. You can see here it's cleverly entitled cmhieval@westat.com. If you send us a note to that, we will respond generally within 24 hours. And we also have a recorded webinar on the 2015 National Evaluation and slides, and we'll be engaging in other activities and partnering, as we are today, with the TA network to try to get the word out about what we are doing and how things are going. I think that pretty much covers it for all of us at the National Evaluation. I really want to thank you for your time, and we'll be here, of course, and to answer your questions as we go along.
Okay, thank you, Abram. Why don't we just open it up for questions and discussion at this point? Colin, can you... Okay. Do we have any questions? If you want to enter them into the box, we can take those. Megan?
So again, you're just entering your name. We're going to wait a minute or two to see if we have multiple people who have questions, and then we will open the lines in about 1 minute. So we'll just wait another couple seconds.
Okay. In the meantime, I have a question. This is Beth for you, Abram. I know that we will be hearing the presentation about TRAC and some of the data collection requirements through that system. There will also be child and family data through that. How will that coordinate with the child and family data that grantees are required to submit for the national evaluation?
Thanks, Beth, for asking that question. We will do two things around that. One is we will design a portal. We plan to have a separate portal for data collection for the national evaluation at this point. And so that will actually look and feel like TRAC, but it will be a separate system. But importantly, we are going to build that in such a way that we will not be duplicating information across TRAC and the national evaluation. So if you're entering some type of child and family data in TRAC, you will not have to enter it again in our national evaluation portal. So that will hopefully help make things a bit more efficient.
Great, thank you. Megan, would you like to ask your question?
Yes. Thank you. This is Megan Freeman from State of Nevada, Division of Child and Family Services. My question is about the Child and Family Outcome Study. So that's going to be different from the NOM child interview that we are going to also be doing?
Yes, it will, but there is some overlap. There are some NOMS measures that we will be using for the national evaluation. Okay. But we do have additional instrumentation for the national evaluation that's beyond what's in NOMS.
Okay, just wanted to make sure I have I'm keeping all the measures straight. Thank you very much.
Yeah.
And how extensive is that additional information, Abram?
It's far less extensive than it used to be for prior national evaluations of systems of care. And so we don't have an approved package, of course, for 2015 yet, but generally we are looking at fairly brief measures that will be used with children and caregivers and adolescents. Very brief. I don't want to put time frames on because I may end up getting them wrong, but we have a very short instrument that we're proposing for youth and a very short instrument for caregivers. Also, the other thing about the instrumentation that we're selecting is that it's free and reproducible, so you won't have to figure out ways to get it paid for or to buy it from other places. So it's in the public domain.
Okay, great. Joy, you're next.
Yes, my question is whether the data portal you're creating for the National Evaluation Measures will allow for uploads of data.
Probably not, but we can talk a bit more about that as we go along, since we're still in the design phases for that.
So from a site perspective, that would be very helpful because we've built our own internal data collection processes because we have lots of other things we're collecting as well. And so to be able to do a data extract and upload it, and we can arrange it to your specifications, but that would be much easier, or else we will be doing double data entry.
Okay. Well, we'll take that back to our design team. That's actually something I've had experience with where we've had our own data systems and wanted to be able to upload them into the national evaluation and prior iterations of this. So I'm aware that that can be very helpful for all of you. So we'll definitely bring that back as we go through the design process for our portal.
Okay. All right, next is Kelly around infrastructure measurement. Do you see that, Abram? Kelly's question is around that they've been doing infrastructure development for a long time, and timelines, time periods for doing that is important, particularly in terms of sustainable work. What's your rationale for collecting data on that in years 2 and 4?
So I guess part of that question, if I understand it, that of course you're not starting your systems from scratch in year 1. And you've been doing lots of work. We're very aware of that, leading up to this place. So for us, the rationale for years 2 to 4 is simply we want to be able to to collect your data as early as possible in the start of your grants because you'll be doing some things, I would say differently, but certainly some activities that are based around the grant funding in one way or another. And we couldn't do it in year one because we need a year just to get OMB approval and our package together. And then year 4 is so that we can capture any changes that may have occurred just as your grants are ending. That said, we do know that very, very well that this isn't like a switch that turns on and all of a sudden you have a system in place or your systems of care developed or that you've expanded your systems of care the day you get the grant or that you haven't done a lot of work leading up to it. So in our instrumentation, we do plan to ask some about your history and where you've been and how you got to the place you're at. So we do know this is sort of a continual process of development. We pick 2 to 4 years just to try to capture you at the beginning and at the end of your grant periods.
Kelly, did that get at your question? Would you like to add something there? Kelly, can you okay.
Oh, good question. Is it realistic to see good sustainable change in 2 to 4 years? I think we'll find out. I really don't know. I think that's one of the things we want to learn is what is realistic, and you all will be sort of helping us learn about that.
Yeah. If I could throw out something here too, I think a lot of this is about progress. We're all very clear that you don't see, you can't say whether there is a system of care, is not one. We're really talking about what progress have you achieved over time to create those system changes that will lead to sustainable service systems over time. So I think that's an important distinction to keep in mind.
It is. And also, while we're on it, it's important to understand, too, we do have reporting requirements, and we are going to do those. However, our real goal here is, we really are here to try to help and to try to help you evolve, and provide information that's hopefully of interest and useful. That's our primary goal here, is to be collaborators and useful.
Okay. The next one that came in, I don't have a name, but the question is, will you be able to provide cross-site data summaries that compares, that they can compare against their own results?
Yes, we will.
Okay. Do you know how that will be?
No, I don't.
How that will be? Not yet.
Not completely yet, but yes, we do. And I know from my experience with local sites that one of the most useful things we often got from the National Evaluation was some comparisons where we could look at what we looked like compared to other sites. Yeah. So we do plan to do that, and we will have to see how we want to group and lump sites depending on what you all look like as we get to know you all better. So some of this will be a learning process for us when we understand more about your sites in terms of what kinds of comparisons will be the most useful for all of you, but we do definitely plan to provide comparative information.
Okay. Maiti Capo.
Yes. Hi. My name is Maite. I'm from Miami, from the Beyond Empowerment Grant. I was wondering, when's the National Evaluation data collection process for the grantee sites that received the grant in 13-14 scheduled to begin? Is it on the same timeline as the 15-16 grantees?
If you mean the child and family data, maybe, yeah. We are hoping to be on a little bit earlier timeline because we do have OMB approval for those instruments, but that will depend on the design process for our data collection portal. But we are hoping spring, early summer to start child and family data collection for the 13-14 sites.
Okay, thank you.
Eric, when will the evaluation liaisons be assigned?
They have been assigned.
Okay. Sites have received notification about that, right?
Yes, they have. We have a couple of sites where we've had some communication issues that we're going to work to resolve, but we definitely have reached out to all the sites and let them know who their liaisons are.
Great. And I think it's also important to note that the Technical Assistance Network lead consultants that have been assigned to each site, and the technical assistance coordinators also have the information about who your evaluation liaisons are, and our plan is to coordinate closely with them as well.
Yes.
So that everybody who's working with sites has information about who else is involved with the sites and can make sure to keep communication lines open.
Mm-hmm.
Joy?
Yes,
Joy Kaufman, do you have a question?
I asked it already. Thank you.
Okay, you came up again. Okay. Other questions? Okay, Eric, Chris, do you have information around the evaluation that you'd like to share at this point? Anything else to contribute?
This is Chris. I do not. I think Abram covered it really well and answered the questions. So no, at this point I don't. Eric?
No, nothing for the national evaluation components. So I think we are good to proceed forward if you guys are ready.
Okay. Anything else from the group? Okay. Then I think we'll proceed to the segment on TRAC, the Transformation Accountability System, and I will turn it over to Michelle and Jessica for that presentation.
Hi, this is Michelle Kiser, and I am the Training and Technical Assistance Lead for the TRAC program. And Jessica Taylor is here also in the room, and she is the project director. So I'm going to give you a brief overview of TRAC. Some of this may be old news to some of you, and kind of go through the different modules, and then we'll take some questions. Which this kind of gives you that same thing. And also we'll go over some general timelines and next steps that should be happening, especially for the newly awarded 15 grantees. So this triangle is just kind of a picture of how TRAC fits into the various levels of the performance management process that happens. The Government Performance and Results Modernization Act of 2010 is a federal mandate to all government agencies requiring the development and use of performance measures in line with agency strategic missions and goals. And so SAMHSA had developed the National Outcome Measures, which then also frame performance management across CSAT, CSAP, and CMHS. And then the NOMS domains are the frameworks that for the TRAC client-level data collection effort, which we will be talking about, and is used to assess performance of programs providing direct services to consumers. We also collect data on grants that are funded to do infrastructure and development activities in prevention and mental health promotion activities, which are your IPP indicators, which you've probably heard of already. So basically, TRAC is a web-based platform so that you can enter your data in, and then CMHS can then monitor your performance based off the data that is entered into the system. And it also keeps you both in line with each other, with your goals. You set your goals in the system and can communicate with your GPO on those through the system. So we have basically 4 modules that are within the TRAC system. We have your annual goals and budget information, which once you start, you enter that information in for all the years of your grant. You set number of consumers served goals, and then you set goals for each of your IPP indicators, and then you'll be able to come back in on an annual basis to update goals for the current grant year and forward as you move through, and perhaps things have changed within your program and so forth. The other module that you'll have access to is the NOMS client level measures for discretionary programs providing direct treatment services, which is a mouthful. We call that services activities. This is your NOMS. It's the tool, the services tool that is entered into TRAC. We have the baseline data entry, and then every 6 months until discharge, that data is entered into TRAC for the consumers. You have your infrastructure development, prevention, and mental health promotion which is the IPP indicators, which that data is collected on a quarterly basis. We do have a TA survey that is a part of the TRAC system, but that is currently not in use in this contract, but it is there. I hit the wrong button. So CMHS leadership determines which of the 4 modules apply to each grant-funded program. So for the systems of care activities, you're going to have your client level, the NOMS, IPP, and then your annual goals and budget. The goals of TRAC are to demonstrate your activities and accomplishments as a result of the grant to various interest groups, and these groups include CMHS leadership, SAMHSA, Congress, and the general public. In addition, there are many benefits to reporting to the TRAC system. TRAC shows what CMHS is doing and with its funding and how your grant is succeeding in achieving its goals. So a little more detail on each of the modules quickly. So after you, normally as the process goes is shortly after you receive your award. Obviously with TRAC just started back up in December. We're in the process of communicating with the federal program director for the sustainability grants that were awarded in September of 2015 to get you trained and into the system so that then you can start entering your data. Every other grantees, if you're still active, need to be entering your data and probably have already been doing so since we came back online in December. So the goals get entered in based on existing plans. Your GPO can go in and then approve the goals and budget information as entered or request for edits, and you can do a back and forth within the system in order to get that to a final state. And then again, as I said before, you can make your annual updates. On the services level, we have the services tool. The data is collected on all consumers that receive services. You enter it directly into TRAC. And as I mentioned also earlier, baseline and every 6 months up to discharge is the time frame for that. And we have reports within the system that help you keep track of when reassessments are due for consumers and how you are marching along to meet your goals that you've set in terms of number of consumers served. The services tool has these 10 sections and various questions related to that within the section. We will offer training on the services tool and also how to enter the data into the system. And we also have all of those training materials up on the TRAC website that anyone can access. So out of the data that you enter into TRAC for each consumer, it's consolidated into a number of reports that you can view online. And you can track the progress of your grant in serving clients, completing your data collection requirements, and then you can also see outcomes. So you have a number of consumers served reports, a reassessment interview rate report, which tells you how you're performing in completing your 6-month reassessments. There's the outcome measures report, which summarizes the change in client outcomes, including functioning, stability in housing, education, crime and criminal justice status, and social connectedness. And then there's also a crosstab and frequency report, which allows you to build tables and run queries for all of the data you've collected on your consumers. You also have a download function where you can download your raw data from the system as well. On the IPP side, we have 7 infrastructure development categories and 7 prevention and mental health promotion categories. Each one has a various number of indicators within each of the categories. The leadership for your program will select which indicators are required for your program. And I believe most of you have received your training on your IPP measures before TRAC got restarted. Again, for the IPP measures, you're entering it quarterly into the system. For the predetermined indicators, The system will only show you the indicators that are required for your program, and your GPOs go in and review the results you've entered and agree or disagree with them as well. Again, you have some reports online for the IPP data, which shows how the data that you're entering for each indicator is matching up against the goal that you've set for that year. And you can see your progress as you move through the year. And then you also have the ability to download your raw data as well. And lastly, preparing for TRAC. If you haven't visited the TRAC website, this is the URL. All of our training materials are available under General Info and Training. You do not need a username or password to access that information. We're in the process of getting some updated information up there. Everything has a PowerPoint with notes to provide you information. There are some YouTube videos as well, and those are the ones that we're currently working on getting the last bit of those updated and online within the next month. And you can start reviewing that and determining how you're going to do this internally for your grant, and also for the NOMS tool, if you need to have IRB approval before you start collecting that data, you can start that process as well. And lastly, I have up here the TRAC help desk email, which is trachelp@westat.com, which we are different than the eval, although our offices are all close to each other. We are a different team. And we will also, I know there were some cheat sheets the GPO put together on the IPP measures and how those, some program-specific guidance that relates those measures to your programs, and we will have those also posted up on the TRAC website once we receive the final version of those. Help desk is available 8:30 to 6:30, and you can call or email, and we usually try to get back to you within 24 hours of receiving an email or message. Any questions for us?
Okay, this is Beth. I'll also start off with a question. While everybody else thinks about it, I'd like to go back to the 2015 grantees who at the moment don't have access to enter data in the TRAC system. From what you told me earlier, my understanding is that they will be contacted directly when they are able to begin that process?
Yes, once we have all of the project directors and the grants for the 15 awards, we will set up training dates. We work with the GPOs to set those up, and then we'll send an email out to those project directors who then can forward that training information on to other staff as need be for them to attend this training. Once the training is completed, we release the project directors' accounts. The project directors have the ability to provide the grant ID and security key to their staff for them to sign up for accounts on the TRAC website, and then the project directors also do the approval and disapproval of those accounts. And as they approve the other staff's accounts, the system sends out emails with usernames and passwords and so forth. And there is a guide for that also under General Info and Training. Also to note, throughout the year we do offer other periodic refresher trainings, and we post those announcements up on the TRAC bulletin board, and we'll send out emails via our listserv.
Okay, great. And what are the 2015 grantees supposed to do in the interim? Should they be collecting this data and then waiting until they can enter it into the system, or what?
This is Jessica Taylor. Eric and Chris are on the phone, and I'll defer to them in a second, but I just wanted to, I don't know if you're aware, but previous to this, to September, the TRAC contract had ended, and it was with another contractor, and so when it restarted in basically October, our first priority really was to stand the system back up and, connect with the existing grantees to get their data in order to meet this report requirement, which was for Congress. And so then we started to focus on contacting the newer grantees and getting them trained. My understanding, and Chris and Eric can speak to this, once the requirement right now is basically once we hear from SAMHSA, you'll be getting notified and getting invited to trainings, and that's when the requirements will kick in. So currently, right now, you're just waiting. Is that correct from your perspective?
Yes, this is Eric here at SAMHSA, and that is correct. What we want the new grantees to be doing right now is just gathering that data, collecting it, while we work with Westat. They're waiting on some information from us about the different grant programs that we're currently compiling to send to them. And so the holdup is here with us in getting those folks access to the TRAC system, but we're working to expedite that here in the next couple of weeks, hopefully, to get that information over to the folks over at Westat so they can do their processes and release that to give folks access. But in the meantime, please just keep track of your indicators and in your data so that we can then enter that in. So I think that takes care of that question. I had one more thing I wanted to add on to, but I want to move away from this subject if there was additional questions and thoughts that folks had. Okay, well, hearing none, well, I wanted to clarify a couple of things in the annual goals and budget information, or specifically in the budget portion of it. As you had mentioned, there is some information where folks put in their allocated budget amounts for things like infrastructure development, services, technical assistance, and mental health promotion. I wanted to just let the folks know on the call that for our program, for our system of care grants, there should be no funding entered into technical assistance, because what that is really tracking is the amount of money that it's costing you to provide technical assistance. So it's not receiving technical assistance. So if you're receiving technical assistance, that's going to fall under, infrastructure development or some of those other categories as that TA would relate to. In addition to that, there should also be nothing entered into the mental health prevention and promotion budget lines. Reason being for that is that our grants are designed to serve young people that have SEDs or serious emotional disturbances, and so that is actually what that is actually tracking is mental health prevention or promotion, and of folks to prevent SEDs from occurring. Our grants are designed to help individuals that have SEDs. So even though your grant community is going to be doing a lot of work around prevention and promotion activities, is going to be from preventing further SEDs from occurring, which is not what that budget line is tracking in the system. So I hope that doesn't confuse too many people, but basically just don't put any budgeted allocated amounts into those two areas of the annual goals and budget.
And we'll make sure when we do the annual goals and budget training to remind folks of that again.
Right. Is there something in a written instruction that is going to the grantees to clarify that?
We don't have anything on the docket to send out written instructions on that, but we could craft an email to send to folks to let them know, to remind them about those.
Yeah, or some other clarifications that people have asked for during the call. It might be helpful to do that. Eric, Chris, other things that you'd like to contribute at this point around TRAC and.
Sure. This is Chris. This is something that has come up in the recent last couple of months with some grantees, probably 2013, 2014. There's been some confusion around who you collect noms on, or the GIPRA, however you want to call it. For those service activities programs, some grantees have felt like, well, we don't serve the kids. Other people in the community are serving the kids. We're basically the pass-through for the money. And I just want to just make sure everybody knows that those kids that are being served by partners because of this grant, they all need to be included as in the NOMS. So data, client-level data needs to be collected on all those youth.
And do they need to be newly served youth who are entering services through the system of care approach, or can they be youth who are already receiving services that are then improved or expanded based on the expansion effort?
It would, we're really looking for people, new kids who are entering the system of care.
Mm-hmm.
Because the idea is to get a baseline before kids are starting to be served with the system of care.
So based on expanded service capacity and new services and supports, it's new youth and families entering the system that should be used for collecting the service level data.
That's correct.
Okay. Okay, I don't see other questions in the box. Any of you have other clarifications or questions that you'd like to raise?
This is Denise with the TA Network. Just want to remind folks that we're not going to unmute the lines unless folks enter in the box whether or not they have a question or a comment. We also want to draw your attention to the box labeled Files underneath the chat box. There's documents that you can download that were previously referenced throughout the webinar. The prior national evaluation slides, the first set. The second document is the cheat sheet that the GPOs at SAMHSA created for the ICT indicators for the 2015 grantees. And the third document are more expansive slides on TRAC. The links to those documents will also be sent out after the webinar, but they're there for you to click on as well now if you need them.
Great. Serena, does that respond to the issue that you raised about having the information in writing? I guess she's not unmuted. Can we?
So I have to review the slide, but it seems like towards the end there were some additional comments that weren't on slides around what not to put in a particular place or what to track or what not to track, and I don't remember seeing that on a slide. So I'm definitely going to download the material and review it again, but I think that there were some things that were just discussed that may not have been captured in writing.
Okay. Okay, Serena, we'll follow up on some of those issues that I have noted that you've raised, some of the group members have raised, with Chris and Eric, and see, as Eric said, if we can put together a little Q&A sheet that can go out to you as a follow-up.
Thanks.
And we have one from Mark Aber.
Hi, this is Mark Aber. I'm from Illinois with the Illinois United for Youth expansion grant. I have a question about the TRAC NOMS and getting baseline data. You know, we're in our start of our second year here, but it's taken us a while to get the processes in place to be able to collect TRAC NOMS. And some children have been receiving services that are arguably improved and you know, would count towards children receiving services under the grant, but we're past the baseline. And I'm wondering if we should just start collecting new with new enrollees and complete the full baseline on out, or whether we should start collecting follow-up interviews and input archival information that we can gather as baseline.
Chris and Eric, this is Jessica. I can provide guidance that we've given previously.
Okay.
Normally, in those cases, we would ask the grantee to enter an admin baseline to get the consumer into the system, and that does two things. I mean, it starts the record and gets them counted towards the number of consumers served, and then they would reassess the consumer for the duration every 6 months that the consumer is in, because as Mark is saying, you don't have the baseline. You won't be able to see the outcome, the change in outcome from baseline to the, reassessment.
does that follow Mark and Chris? I'm sorry, I'll show you some Mark is our core. Eric and Chris, does that follow your understanding in terms of guidance?
Yes, this is Chris. It does. Thank you.
Okay. Joy Kaufman, I see that you'd like to know if it would be, you could get information for the 2014 grantees about when the IPP data will be migrated from CDP to TRAC.
I can answer that one. Or you want to do that one? You should be receiving an email this week regarding that.
Thank you. But the data has been migrated, but not all of it. Some of it might not have passed through the migration process.
Yeah, that's what the email will be telling you.
Okay, great.
And so does that mean we need to re-enter it, or?
Yes, there was sufficient amount of data that was missing to where we couldn't enter certain records. And so what grantees will be receiving is a full account, a summary of the number received, the number that were accepted into the TRAC system, and then the number that were not entered. And then you'll also receive a record-by-record account of whether it was entered, and then if it was not, the reason it was rejected, essentially. And that should be coming out either at the end of this week or beginning of next week. We're also informing GPOs. We normally send out the email first to the GPOs so they're aware of things. So,
thank you.
You're welcome. If you have any questions when that comes out, just please follow up with the TRAC help desk.
Yeah. We do have the presenter contact information at the end, which you'll see, and I think everybody would be happy to take your questions by email following the learning community meeting.
Chris, this is Denise Solstack with the TA Network. Can you also explain how it's important when there are no new indicators to report for each quarter that grantees are to check that box so that they don't get questions from their GPOs about that?
I'm actually going to defer that and see if Jessica can answer that, or Eric.
I'm going to defer to Michelle.
Or Michelle.
We will, well, for the grantees that haven't had training on the system yet, you will learn about the no new result function in that training. But yes, there is a box on the result record when you're going in to enter IPP data to indicate that you have no new results for that indicator for that quarter, which is a fine answer because not all indicators will you have activity every quarter. And that's a positive response versus doing nothing is a negative response. So if you have a blank, your GPO will call you and say, why didn't you enter any data this quarter? So if you don't have activity, make sure to check the no new result box. And that's all you have to do is go in there and check that box and click save, and you're on your way.
Yeah, basically not doing that, it appears that there is missing data, and we have to follow up on that. But when you hit no new result, we just know you didn't have anything to report that quarter.
Okay, other questions, and if you would put your name in the poll if you have questions, that's helpful for us to organize that. Other questions, other issues you'd like to raise? That means either we've done a very good job or you're totally confused. Okay.
Well, this is Eric. I'm sorry, Beth. This is Eric. I just want to say, if folks do have follow-up questions and things like that, please feel free to reach out to your GPOs, and we will do our best to coordinate a response.
Yes, and we should have put that on the slide also. Besides the presenters for this, your GPOs and Chris should be available to answer these questions, and it sounds like perhaps we'll be able to put together some additional information about some of the answers that were given today to distribute to all of the grantees as well. Final opportunity for any of the presenters to add anything else to the conversation.
Oh, thank you for your time.
Okay. All right, we hope this has been helpful. There have been a lot of opportunities about the requirements for evaluation and TRAC, and we hope that this dialogue has been helpful in resolving some of those questions that you had. In closing, a little bit early, I'd like to talk a little bit about the next Learning Community meeting, which will be on February 17th at the same time. The topic that we are looking at tentatively is around match. It's also a topic that many of the grantees have raised in terms of what they can use for match and what they can't and what strategies are allowable. And so we are in the process of trying to line up those people at SAMHSA who can talk to us about match and answer questions specifically on that area. I just, again, want to reiterate that the Learning Community meetings are open to any leaders in grant sites, and they will be on the third Wednesday of the month at 2:30. There won't be a meeting in March. We anticipate that many of you will be at the research conference in Florida, since that's one of the approved meetings that grantees can use to fulfill that meeting requirement. And we also want to point out that the link below is the place that you can click to join the learning community. And if you'd like to receive future notifications of meetings and invitations to register, if you click that link, you will get those automatically. They also are in the TA telegram that you receive every Tuesday. And if you don't receive the telegram, make sure that you indicate that you want to be on the list for the distribution list for that as well. But the link to register is also in the TA telegram. So we thank you very much for your attention. We hope this has been helpful to you. And we also want to get some suggestions from you as to priority topics that you'd like us to look at for future Learning Community meetings. So I think the best way to do this might be to email them to us, or you can, for the next few moments, enter some of your ideas in the chat box, and we will definitely put those into the hopper for consideration for future meetings. So again, thank you all for your participation, and thank you to all of our presenters and to Eric and Chris from SAMHSA to participating in this and rescheduling your other meeting to enable you to do that. And Denise, do you have any other final words from the TA Network?
And that's it. We will be sending everyone who registered for the webinar a follow-up email with a link to the slides that we used today, as well as other resources we referenced, and you may use that email string to send back to us and just suggest other topics for consideration. So thank you for your participation.
Hello?
Hello?
I'm literally just finishing up a webinar.
Colin, you want to mute the line?
Thank you very much, everybody.
Thank you.
Thank you, guys.
Thank you.